Good afternoon, everyone. I'm going to present a study on clinical profile and distribution of peripheral retinal changes in myopic population in North India. Increased prevalence of myopia is a growing concern, and it is estimated that it will reach till 49.8% by 2050, as it's depicted in this graph. And it's associated with increased prevalence of peripheral retinal degenerations also, which can be innocuous or can predispose to certain visual threatening complications like retinal detachment. So the aim of my study was to evaluate the prevalence of different types of peripheral retinal changes in myopic population of different age groups and sex. The objectives were to document the type of peripheral retinal degeneration and its fundus location in different age group and sex, and also to record the axial length. It was a cross-sectional study in which 600 eyes of 300 myopic individuals of 10 to 40 years were included. They were divided into 3 age groups, and the myopia was divided into mild, moderate, high, and severe myopia. The routine visual assessment and ophthalmic examination was done, including the binocular indirect ophthalmoscopy with scleral indentation. The findings considered were lattice degeneration, white without pressure, white with pressure, snail tract degenerations, peripheral chorioretinal atrophic changes, retinal holes, tears, detachment, and they were subcharacterized by the fundus location. The results, any type of peripheral retinal degeneration was found in almost half, that is 53% of all the myopes included in my study. Lattice degeneration was the most common finding, followed by white without pressure and chorioretinal atrophic changes, and they were situated mostly in the temporal, either infratemporal or supratemporal quadrant of the fundus. A positive association was seen with increased spherical equivalent of refraction and axial length also. Coming to the discussion on comparison of our result with other studies, ours was an observational hospital-based cross-sectional study as compared to the previous studies, which were also mostly cross-sectional studies. Ethnicity, different type of ethnic origin people had different type of results. Like in a study, it was found that Indians have a lower incidence of retinal detachment than Caucasians, which was done by Elneri et al. Similarly, age had a positive association in most of the studies, like in Beijing eye study, Shilpai eye study. Gender doesn't had any significant role. This is a table in which our study was compared with the previously done studies. Similarly, the axial length was found to have a positive association, even the severity of myopia, and fundus location, similar to our study also, most common fundus location was either infratemporal or supratemporal quadrant of fundus. Coming to the strengths of the study, in this study, myopic population of all the grades and severity was included, rather than including only high or pathological myopia as it was done in most of the previous studies. A wide age group ranging from 10 to 40 years, which included children as well as young adults of both the sexes, provided a better and detailed analysis. Certain limitations were there. It was a limited sample size, and it was a hospital-based study in which only those patients who had come to the hospital for some vision-related problem were included. Use of data from 10 to 40 years age group does not give insights on overall proportion of myopic lesions in elderly population, as it was found that certain lesions like chorioretinal atrophic changes are more common in elderly age group. Then PVD, it develops at a significant younger age in highly myopic eyes, which can explain the early occurrence of PVD-related peripheral retinal changes in highly myopic patients. The documentation of PVD by OCT could have given an extra edge to our study. So the take-home message is, any ophthalmic examination without a careful peripheral fundus examination is incomplete. So peripheral fundus examination is a must, particularly in myopic patients. And the documentation of axial length should also be done, as it can help us to evaluate the early detection of progressive myopia also.